All right, we good? We can see? All right, cool. All right, so as many of you know, so I just last week was my last week in person at Boston PT and Wellness, which is kind of crazy. All good things, but Steph and I are moving up to Rochester in February, and she's been crushing it with her own totally remote ACL rehab. And it kind of, there's some other people in here too that I know have been dabbling with it, and it really opened my eyes to just how effective it can be. And also for like myself, I know I was definitely starting to feel a bit burnt out, 7 years of practice doing 40-hour weeks in the clinic. And so I think remote rehab is also a really nice way to kind of gain back a little bit of time flexibility in your life, because I'm working with like 7 clients right now, and I'm sitting my butt on the couch on Sunday mornings doing some check-ins, and it's a pretty sweet gig. So I'll kind of make my case for it tonight in terms of like why I think it's so valuable and why I'm kind of championing it for this community. But we'll give it some context with a case. So again, big picture stuff, why I love remote rehab is because, when we look at what the good rehab looks like, it emphasizes these skills and all things we talk about a lot at CALU. So good listening communication skills, good interpersonal skills, subjective exam skills, flexibility, creativity, resourcefulness, and then the application, how we're thinking about EXRX, through the different BPS informed lenses that we might use for clinical reasoning. And the beautiful thing is that remote rehab literally uses these skills. It's the bread and butter of what makes really, really good remote rehab are these things right here, which again, I know is the norm for this community, but isn't really necessarily the norm for what we are coming out of school in terms of what we're emphasizing in our academic education. Because again, this is, I think, one big question for remote rehab is to manual therapy or not to manual therapy. And, I saw a post today that was really good. It was a really good flow chart on it. I personally have zero issues with manual therapy. I think that time and place, if people want to utilize it, that's great. My personal bias is it's not something that I go out of my way to do. If it's meaningful to the patient, I'm happy to have a discussion and utilize it in our therapy. But part of the reason why I love remote rehab is because it just sets up the constraint where it's just not a thing that we can do. So, because there's a lot of I just think there's a lot of kind of slippery slopes sometimes when we are in person, and we can kind of go down the manual therapy route and the narratives that might be attached to it and what we're trying to fix or not fix or whatever. I love remote because it's just not even a conversation that necessarily needs to happen. And if it's something where the person wants to continue to get some sort of in-person manual therapy, if it's like someone with persistent pain, I'm all for that. So I'm super supportive of it. It's just nice that I don't necessarily have to provide something that I don't necessarily feel super strongly about anyway, when we're talking about long-term outcomes for people, especially I'm working with a decent amount of people with persistent pain. That's what we're going to talk about today, right? You look at long-term outcomes, whether it's in person with manual versus remote, I would go on to say that I would think the outcomes could be pretty similar, but definitely not inferior for remote rehab. The other thing to consider for remote rehab is just that it's like there's so many different ways to go about it. I think traditionally when I talk to some of my parents' friends, they're like, "Oh, you do remote rehab? So what? You just like have sessions and you watch them exercise the whole time?" And it's like that's not inherently bad or wrong, and that can be a place in remote rehab. Me personally, I don't really want to sit there and watch people exercise for 30 minutes. Kind of like drove me nuts during COVID. So, is it going to be more session based? Is it going to be more remote programming where you have session check-ins, or you just have like phone call or Zoom check-ins? And also setting your own personal boundaries of how much you're going to be communicating with them, how much of it is on their own versus like setting up times to communicate with them clearly so that you're able to build healthy boundaries with good expectations, which is all part of strong communication skills. But all this to say, there's no one way to do it. So what I'm showing you today, this is just the way that kind of fits within what I would feel is effective rehab. And so hopefully it can be a good model for you and you can kind of do whatever feels good for you. Keeping it simple, what does my process look like? initial connection first. So it's free. I offer free screens for like 15, 20 minutes where I'm really just trying to get a quick pulse on their story, see if it's a good fit, also learn what they have access to equipment wise. Because that's one of the things for remote rehab, at least for working with me, where like we can definitely be creative if people don't have really anything. But again, like if we really want to make progress, at the end of the day, people are going to need some sort of access over time, whether that's getting more equipment for themselves. Like I have a client that is starting to low key build out a little home gym, which is sweet. We started with like bare bones, nothing. And you have some people that might just join a gym or some people that have like an apartment gym, but that's part of the initial connection. Next up is the initial consult. So that's primarily through Zoom. But basically, that's where the bread and butter happens. That's the detailed history and subjective portion. It's the red flag screening, potentially some basic objective testing. But I'll be honest with you, I do the majority of my objective testing during our anchoring week. So during the first week of programming, I'm giving them different movements to video and to give me feedback on. And that's when I'm really getting a lot of my objective data. I might do some simple, like if it's spine, I might do some simple like spine clearing where we're going through range of motion and basic things like that. But there's obviously limitations to remote. There's only so much you can really do. So I try to keep it simple, but the emphasis is really on taking a really good history and then trying to help make sense of what's going on and give them maybe a little more clarity on why they've been spinning the wheels. What can we do to, help them get towards their goals, learning what their goals are. All of the kind of setting expectations, and then, being, and this is developed over time. When I started like this, my operation was bare bones, kind of just like on the fly. Now, have a nice little like onboarding email that I send that just helps to those in the audience, if you don't mind, just mute just so for replay quality. But just onboard, like the more expectations and clear communication we can give up front sets things up for success. Because definitely in the past, I've worked with people online where I didn't do a good job of setting expectations for communication, and they kind of either fell off or were inconsistent, and that's a reflection of me. And so definitely make sure I'm trying to do a better job of communicating, how we want to be checking in and how we want to be doing that. So I'll share a little bit about that. After that initial consult, that's when it's kind of a little front heavy. I'll block out like an hour of time. And that's when I'm doing my, initial program creation, where I'm kind of looking at the main KPIs, the things that are really going to be helping to track it. I'm helping to create kind of like a brainstorm of the different movements that I want to do for their program. And I'm building out their program, and I'm giving them the explicit instructions on how to anchor. And I'll show you an example of that in one of the following slides. But then from there, like it's front heavy, but then from there it's game on. It's really just ongoing care and monitoring. Once you create that initial program, I mean, that's a lot of the friction to overcome. But once you get that, it's just getting their feedback, make sure you're getting their feedback, and then updating accordingly. And it takes me about 15 minutes to, sit down on a Sunday and update someone's program. I'm generally only doing 2 to 3 days of programming for them a week. Unless I've worked with some barbell athletes that want to train 4 to 5 days a week, and those will be rare exceptions. But for most people that are dealing with persistent pain, 2 to 3 days a week is plenty to, especially for folks that have struggled with consistency, 2 to 3 days a week is plenty to start with to build some consistency. Okay, so that's a little bit of the back end stuff. Now we'll get into the case. So this is a 30-year-old female. She's a pediatric OT. Her occupational demands, lots of driving, house to house, sitting in traffic. She's in New Jersey. Awkward lifting and positions, working with the kiddos on the floor. Her activity history is that she loved playing volleyball. She played in high school. She played club volleyball in college. And she enjoys like more boot camp style workouts. So like Orange Theory Fitness or F45, those types of things. She has access to an apartment gym, which has all the things. So like, these are just some of the things that I'm learning to see like, okay, is this going to be a good fit? And like, yeah, definitely. So it all started 15 years ago. early teens, onset of low back pain after sleeping on a hard floor for multiple days on vacation. Ever since then, she's been experiencing basically off and on low back pain that crept up and began to experience mid back pain as well as neck pain. So full spine now. Um, she's been working with a chiropractor off and on over the last decade. So really, ever since the beginning, she's kind of been going off and on and getting different treatments. And recently, she's been going once a week, focusing on some soft tissue mobilization, heat stim, some adjustments. She denies any real neurological symptoms in a sense of any like radiating or radicular symptoms into the upper extremity or lower extremity. Um, she has yeah, no, there was really no other red flags or anything that was kind of like I don't know, making the spidey senses go off. Like this was just as I was listening to her story, it really sounded like someone that's been flagrantly mismanaged by the medical system for the last 15 years. And we'll get into a couple of other clues that I thought were helpful as well. So um, Ags sustained postures. So when she's sitting for a while and driving, that will irritate some of her low back, mid back, neck. Driving, looking with her neck can be a little bit provocative. Being on the floor with her kids for sustained amount of time is something that will provoke her symptoms. Awkward lifting. So like she was like, yeah, I basically live out in my car. So when I'm reaching over to the side and grabbing things, that will exacerbate it. Lifting kids, that will exacerbate it. And this was something that was very clear in her history was basically, a pattern of too much too soon, like the classic boom bust cycles where, she would get back into like boot camps consistently, but it would flare her symptoms up. Or she got back into a recreational adult volleyball league, but it flared her symptoms up. And then she kind of stopped and didn't do anything for a while. Things that make it feel better, heat and stim, gentle stretching. And she literally said, like, there was times in her past where, like, when she has been able to be consistent with kind of working out on her own, not with the boot camp stuff, she has felt good when she's moving. And that's something that she said a lot too. It's like, it's the sustained postures when I'm sitting for a while, when I'm not moving for a while, but like when I'm moving more, I feel better. And I'm like, okay, great. Like, this is good. These are things that we can kind of leverage. And I think bode well for someone that's going to do well with this type of more active approach. So for me, like on that call, with the history, right? It's like, and this is where it's interesting, right? It's like in more of a traditional insurance model, there's not so much pressure to really like quote unquote sell anything. And even in this, honestly, it's like if it's a good fit, it's a good fit. Like it shouldn't be an aggressive, like you need to work with me, otherwise you're doomed to have spine pain for the rest of your life. But like if you genuinely think you can help this person, like if that comes across, that'll probably be good enough. And that was basically what I was explaining to her, was identifying a couple of the clear patterns that we recognize in her history of like, look, I totally understand, you've been working with this chiropractor forever and things are probably well intended, but it sounds like there was never really a plan to follow. Like you've kind of just gotten mostly passive treatments. It sounds like when you've gotten back into activities, it might have been a little bit too much too soon after not really conditioning for that. And sometimes that can lead people to kind of flaring up. And so I think for us, and this is also why I'm really passionate about remote rehab. And one of the things with more of a traditional insurance system that can be a little tricky sometimes is like the reality is that for a lot of these people, people dealing with persistent pain, coming into PT once a week, I don't really think that's going to like radically change anything for them. Like I give people the 99 and 1 rule where it's like if you're going into PT twice a week, like that's at most 1% of your week. Like what the hell are you doing the other 99%? And I think that giving people a really digestible but doable plan that they can follow is really good. And I know I've been guilty when I've been treating, is like you want to give people these good programs to follow outside, but it's not something that you get reimbursed for. It's something that you have to stretch yourself as a therapist to make sure they're getting. But the reality is that's the stuff that's really good for helping really monitor how they're progressing and getting better. And I'll just give them, like, in the past, I would just be like, all right, here's an email with like this list of 5 exercises, like do this, you know what I mean? But it's like, it's not really sensitive to how they're doing with it, the reps, the dosage, like we're not knowing how to progress it appropriately. And so that's why I love remote rehab, because we can work together and check in as needed and have consistent feedback multiple times through the week, um, in a way that's going to allow them to build consistency. And that's the whole thing, right? And I think for me, graduating as a new grad, I don't know that I would have been ready for this, because my whole clinical paradigm was still wrapped around like, oh, if you have chronic pain, we need to find the thing that's wrong. We need to fix the imbalance that's wrong. We need to get you in so that we can do X, Y, and Z. When the reality is that there's a lot of different ways that we can help people with persistent pain, and there's not really any way that's that superior to another. And so for me, my bias kind of falls back into, well, let's create a simple movement based approach that's going to progressively, expose you to more weights. And it's not that you have pain because you're weak, but there's a lot of really cool therapeutic things that happen when we start to get people building implicit confidence in their body. And we can do that through exercise, especially if it's something that they're open to. And that's, for some folks with persistent pain, they might not ever want to exercise, and that's okay. Then maybe I wouldn't be the right fit for them. But I know that for some people, this approach can be really helpful. And it's letting them know that, like, look, I can't promise you that in like 4 weeks, your pain's going to be totally gone. If you've been dealing with spine pain for 15 years, odds are this is going to be a little bit of a process. But I'm telling you that if like you haven't tried this yet, like you haven't had an actual plan where you've been slowly building and grading the exposure to things, I think we can make some really, really good progress together. And we look back in like 2 to 3 months and it's like, cool, like if you're doing a lot more than you're currently doing right now and your pain is the same or less, hopefully, which it could be, then like, let's go. Like, I think there's a lot to be optimistic for, given that you haven't tried any of this, like none. um, and so that's really the case I'll make, like for this person. That was some of the stuff that I spoke about. For her, like this is for persistent pain rehab, this is pretty much the bread and butter for me. Like phase one goal, consistency, just like showing up, being consistent, and really for me, like making it as simple as possible. My framework for them is like, we're aiming in this phase, low to no symptoms and moderate to high effort where able. Doesn't need to be complicated. And for me, there's times and place to push into pain. Obviously, I'm totally fine with that in certain cases. But for someone that's been dealing with persistent pain for so long and hasn't explored movement, there's so many ways to modify and add variety to movement that I'm confident that we can create ways where, like for me, like my cutoff, again, this is subjective. This is just my personal cutoff, is like a 2. Like if it's like a 2, maybe 3, or like at most, like that's really flirting with what I would be comfortable with. I'm really trying to keep it 2 and below. Because at the end of the day, like I just want to build a win. I want them to have a positive experience with movement that's really not triggering them. And if they're having more than that, there's ways to modify it. Like there's so many ways to modify exercise that I think in this phase of rehab, there's no need to push past that, because I think the trade-off is just not, I think there's more cons to be had than pros in this scenario, as opposed to building the base and then maybe dipping in as we need to. So after that, so go through the history, tell them about how it's going to be going down. We're going to be using True Coach. That's the app that I use. It's easy. Steph uses Everfit. I know a lot of people really love that experience, but True Coach is just what I've used forever, and it's easy enough for me. There's an app they can download, and I tell them, I'm going to work on your program. I'm going to send you an onboarding email. So I send them an email which basically lays out how to create your True Coach account, the anchoring process. So explain to them how we're going to do that. And I'll show you that in the next slide. And then this is huge, because this is where I dropped the ball in the past, is like being crystal clear with communication expectations. And so like, I'm going to be showing up. I'm going to be busting my butt to make sure I'm giving you thoughtful stuff to do. I need you to give me the feedback that I ask for and check in appropriately. And that goes with saying like, life's crazy. So if shit's going, like if you're having a busy week, or like, I work with a mom that has young kids, I'm like, just communicate to me that like it's a little bit of a shitstorm, so I'm not just like left on red wondering if you're doing the program or not, like just let me know. Like that way we can be flexible and modify, but really setting the tone for open and consistent communication is such an important uh, key driver for success, in my opinion, for remote rehab. So I'm just sharing one example. I'll just read out loud for anyone that is going to be listening on just audio. But basically, so it's like day one, squat emphasis. Super simple. We're goblet squatting to a box. We're keeping the range of motion constraint because it's for someone with full spine pain, probably going to be more tolerable to have some sort of object that we can go to, and then we can scale it down, less noise, in my opinion. So the goal for today's workout is finding a tolerable quote unquote green light movements for training. You can use the bench in place of a box, starting with body weight, perform 10 reps of squat to the bench. Meanwhile, there is a video uploaded in this for demonstration. The goal, so starting with body weight, the goal is to go up 5 to 10 pounds each set. Complete 10 reps until you reach a weight that feels like a medium effort, think 5 to 6 out of 10. Or if your symptoms reach a 2 out of 10, then go back down and wait to make sure it's underneath that threshold. Once you find that desired weight, that is the final set for today. Record the video of the final set, record the weight used for the final set, record effort scale 0 to 10, record symptom scales 0 to 10. Now, this harkens back to a old clinical thing, which is like, no one wants to be the therapist that's like, on every exercise, like, how's your pain? How's your pain? How's your pain? How's your pain? Fair. In remote rehab, it kind of has to be that way. And to be honest with you, I don't necessarily think that's a bad thing, because I need to know that feedback so that I can modify things appropriately. And so that's the instructions. And then that's the feedback that I got. Okay, I worked up to 15 pounds. I got up to an effort level of a 5-6, and I got up to like a 2-3 on my symptom scale. And I'm like, okay, cool. We literally just anchored what her current capabilities were, what she felt safe doing. That kind of met the criteria that we described. And that's basically what it is for all the other exercises. Is just for week one, there's very explicit instructions on what feedback we want and how to kind of go about it with a video demonstration. And I just think it's great because that's testing that I don't have to, like, I could do that in person, but it's perfectly good to just do it, remotely like this. So the other thing, so for remote rehab, it's yes, the programming, but there's also other things, right? Because we talk about the 99 and 1 rule. So there's we also did a lot about like kind of the education about helping her to kind of understand what's going on with her back, her spine, and like what it may not be, what it could be, but ultimately, like, she was asking about if she needs an MRI or not. Her mom has a history of chronic low back pain. So like, take all the time we need to address all of those types of things. We spoke about the utilization of movement snacks. And so I just uploaded a day in there for her. It's not like a day for her to do every day, but I just gave her like a menu where it's like, hey, here are some basic movement snacks. Here's how you can utilize them. Like throughout your day, just try the cat cow quadruped rocks. Like the other ones, like if you have time, you can start to integrate these throughout your day, but giving her the education on how to utilize movement snacks to complement what she's doing to break up some of the bouts of stagnant posture. We talked about, the benefit of maybe adding in an aerobic day where we can find a mode that she tolerates. So she doesn't tolerate the bike, but she tolerates the elliptical. So like, great. That's another way for her to kind of exert herself in a way that's going to have low symptoms and build more confidence in her body, especially wanting to get back to like volleyball boot camp style things. Building that energy system is not going to be a bad thing. And then here's the groundbreaking, fanciest exercise program ever. So day one, and most of her days are pretty much full body. But day one, and this is just how I organize my thoughts. So I'll have day one that's kind of like a squat emphasis. So we have our goblet squat to a box. We have a chest supported row. I like that variation for someone with kind of persisting chronic, spine pain, because it's generally going to be probably well tolerated, way for them to build it up. Going to try a split squat, body weight, dumbbell bench press. Historically, she didn't love planking. We spoke about just building it up, even if it means like 5 to 10 seconds, just to see how she does with some of that weight bearing, and dead bugs. Day two, hinge emphasis. dumbbell RDL, seated row, SLDL, incline push-up, tall plank into downward dogs, single leg glute bridge. Day 3, more of an upper emphasis. So dumbbell bench press, bent over dumbbell row, step ups, prone tees, bicep curls, and front foot elevated calf raises. We are trying to work back towards running at one point, so got to sneak in those calves. So program, honestly, super simple. I really try not to do more than 6 exercises at most, because especially when we're getting started, trying to limit the noise. Like I want to try and just get started with something simple, not a ton of volume, explicit instructions on how to start, and let's just start to build some wins and build some momentum, and then we'll progress from there. And I'm pretty pumped because, we're now into week 4, and her goblet squat to box, which was, when she anchored herself was like 15 pounds, was creating a 2 to 3 on her symptoms. Now she's doing 3 sets of 20 with 3 sets of 10 with 20 pounds with an effort level of 6 and symptoms of 0. Love to see that. Chest supported row, same thing, mild 1 to 2 in the right scap, but up from what she was doing. She wasn't tolerating split squats, so we just went to mid-range split squat holds, and lo and behold, super high effort, super low symptoms. Love that. Dumbbell bench press, high effort, low on the symptoms. Let's go. Like as I'm reading these things, I'm like grinning ear to ear. I'm like, this is amazing. Like so good to see it. Is it always this smooth? No, but it generally can be relatively this smooth if you're kind of dialing it in appropriately. And she's already up to 35-second holds on the tall plank. And it's just like, hold on here. Let's see. It's just being really slow. Sorry. So it's like week 4, effort high, symptoms are low to no, and we're just getting the happy dance on, because remote rehab can get those wins. It's super fun because, again, the standard of care is so bad that like literally look like this program that I did, like it's not rocket science, but like this can be life-changing rehab for someone, because literally the standard is so bad, and people are so mismanaged by medical providers that keeping it simple, getting consistent feedback, modifying appropriately. We worked our way very slowly over the 4 weeks. We didn't, push it, like kept things chill. And yeah, so that's the overview. Kind of flew through a lot, but I really just kind of wanted to open up for Q&A and answer questions as honestly as I can for you all, and chat about the case. So if you want to pop cameras on, it's just going to be conversation from here on out. If not, that's okay. We got some faces, which is cool. Oh fuck, Nick Hannah's here. God damn it. All right, call's over. All right, so let's get some questions. I know there's got to be some questions about clinical, either on the clinical side of things, on the logistics side of things. Maybe you're starting your own remote rehab. Fire away.
Hey, Zach, I have a logistical question.
Yep.
So first one would be from like a license perspective. So when you're treating folks in other states, have you thought through that? Like, how does that work exactly?
I'm just assuming the risk. I have personal liability insurance, and I'm all right going into the gray with that.
Okay. And then same vein, like a logistical question. So are you like making it a package of X number of sessions or X number of weeks, or do you just like change it per month, or like how are you doing that?
Yeah, that's a good question. So again, all totally different ways to go about it. I'm actually tinkering with how I think I want to move to doing it. Right now, depending on how many days I'm doing, I'm charging anywhere from like 200 to 300 a month. So I do it more on a monthly basis, and I'll let people know, like, I don't care if people pay me all up front or if they pay me monthly. It doesn't really matter for me. So I'll communicate to them, but I'll also let them know, like for this individual, I was like, look, like you've been dealing with this for like 15 years. It's not going to we might not see radical changes in a month. So I would like to at least work with you for 3 months. And then we can kind of figure out how we want to go from there. So it's not like she's paying me everything all up at once, but it's just a mutual kind of agreement that that's sort of like at least the starting point of our relationship working together.
Cool.
But I think what I'm going to be going to, because what I've realized is like, it really is like it's front heavy for me, at least in my opinion, between like the initial consult, the initial program creation, the onboarding. So I think I'm probably just going to have a higher kind of like first month rate, and then it'll drop down to like 200, 250 for ongoing after that. But there again, lots of flexibility in how people want to go about doing that. This isn't my full-time gig. So I'm also not, probably could be charging more, but that's just where I'm at right now. I'm slowly building confidence in asking people for money. It's not something that has naturally come to me at all. You can either do the raise hand emoji thing to cue yourself, or if you're feeling bold, just let it rip.
I got a question. So you talked about like on that first like session saying like, hey, your pain's probably not going to come down like right away. It's going to take some time. How do you kind of get around if you can tell they're like struggling to buy in? Like, for example, I've had some patients where I've had that conversation, like, this is going to take time. You can tell right away. They're kind of like, well, I came here to get my pain settled right now. It's like, it's not how it works.
Yeah.
What's your take on that?
Yeah, that's a really good question. I don't know. I try to be open and honest with them. I try to be realistically optimistic, where I try not to paint a grim picture where it's like, we're not going to be able to do. I'm like, look, you never know, like your pain could be better in a few weeks, but realistically, it's probably going to take some time. That being said, the hope is that as we're starting to see some of these more kind of like quote unquote functional improvements, that hopefully it's starting to decrease. If in the meantime, like pain relief is a really important thing to you, that's where you can get down on some, analgesics, or any like of those more passive modalities are fine to utilize. But again, I'm probably not going to be everyone's cup of tea, and that's okay. It's not always going to be a great fit for everyone, but just trying to stay aligned with what you feel like is, doing right by the patient.
Thank you.
Yeah, no problem. So I'm just going to read Azita's question. After these improvements with you, did she at any point have some moment of self-reflection, realization, and ask your opinion on her past medical management? Just wondering if that conversation has come back up since the initial call. Yeah, good question. It hasn't. Not in terms of like another call. We kind of went hard on that during our initial call together, and she's not a PT, but she went to Ithaca with me. So like we had a decent rapport where, she already had a little bit of skepticism about kind of like her past treatment. So we kind of went hard, in the paint. JP.
Thanks, Zach. That was super helpful, man. That's I know I've started dabbling with some of this stuff, and I've been learning a lot along the way. So this is helpful to see how you do things too. Question for you, as far as video feedback, is that something that you're just mainly collecting in the beginning during that onboarding week? Or is that something that you're asking them to send videos throughout the entire process with every workout? And, where have you found success so far with that?
Yeah, good question. So I definitely I've gotten like someone's like, do I have to record a video for every single fucking thing that I do? And I'm like, honestly, so definitely at the beginning. So like anchoring week, I want to see everything. Moving forward, if there's some like step ups or whatever, like things are looking relatively good, I don't need to see a video of it every week, honestly. So I'll take that out from the instructions. So I'll keep them for more of the compound lifts. But I won't have it for everything. If I see that they're doing it pretty competently, kind of just take it out. And then if I add a new variation in, I'll add back in a video. But hopefully that helps. I think it, again, to each their own. But
that makes sense. Thank you, man. Because that's been the thing that I've run into is like, I think what you said as well is setting expectations in the beginning is something that I can definitely do a better job of, because what I've run into is having a difficult time getting the feedback that I need, whether it's video, whether it's how they're doing throughout the week with the workouts. And so yeah, moving forward, definitely going to set better expectations, but also realize when it's essential to have a video and when it's maybe not as.
Yeah, I mean, so like, I mean, again, this is just to my biases. Like, I have a pretty, flexible range of what would be an adequate movement pattern. Again, like, I want to see it, make sure that it's looking decent. But for me, the information I care way more about is the effort and the symptoms. Like, that's, if I'm only getting one thing from them every week, that's what I really want to get. I'm also not working with people doing heavy ass lifts, like a goblet squat with 20 pounds. Like, all right, we're going to be good. All
Yeah,
right.
thank you, man.
Yep, you got it. Casey.
Yeah, so I have two questions. So I just started into like the remote rehab as well.
Cool.
And I'm kind of doing like a hybrid where I'm taking patients from my gym and just doing like an eval with them, and then start like setting them up with like a plan of care from there.
Cool.
Because I haven't really felt fully comfortable to make that switch of like doing the full eval like remote. Is there any tips, or like, I guess, I don't know, that's like the one part that I just don't feel fully comfortable doing yet, I guess, is just that initial eval.
Yeah. What population of people are you working with?
Like strength athletes.
Okay. So, I mean, if you have a convenient time that you're able to like see people for an in-person eval, like if I had a space and I would probably still do the initial eval in person. If I was in a community locally and I had the space for it and I had the time to do it, like it's taken up an hour of my time either way.
Yeah.
And I think there's obviously value to that. But I guess my challenge would just be to you would be like, that's where things like, especially with strength athletes, it's like, I can watch videos of them doing their primary lifts. It's like, yeah, I would like to see some different joint screens and things like that. But, a lot of the other objective testing we can do fully remotely with giving them explicit instructions. And so I think that would probably be my challenge for you, is like thinking about how you can bake that into your testing process. And
Yeah.
maybe that might lead you to feeling more confident to doing the whole thing remotely for certain contexts, is like having that piece kind of dialed in for those different things, if that helps.
Yeah. And then the second part is one of the most beneficial parts I've seen from like the online stuff is being able to implement a lot of different like lifestyle factors that it's hard to when you're just seeing them like once a week, like sleep, nutrition, all that stuff. Is there a way that you're kind of educating them on that stuff without just like overloading them?
Yeah, so that's a good question and a good point. For me, like I'm trying to approach this as simply as possible and try to just like build consistency with sort of this lane of like getting them moving. We talk about that stuff during the eval, but it's like, it's hard for me to be kind of like the on them, making sure that those other factors are going in the right direction. Like obviously they're important, but like she lives a busy life, crazy job. So for me, it's like, I want to control the controllables right now, build some good habits, probably work towards more of that stuff. But at least for me, I'm just trying to keep the equation as simple as possible for starting off.
Okay.
And again, if there's a time and place where that really is super important, like that might be even something that I might refer out for to get help with, if it's something that's really, really implicated in their persistent pain. Cool. David?
Hey man, so I was just wondering, how often are you following up, and like, are you following up just through
Yeah.
True Coach? Are you doing anything like depending on the patient? Are you following up through Zoom, like multiples or Zoom calls throughout the month, or kind of what's going
Yep.
on with that?
Really good question. So basically what I do is I have 2 like 30-minute blocks on like Tuesday morning, Thursday morning, where I'm able to go in and do like look at their day 1, day 2, and just give some feedback. Like if there was anything there, like they had a question in the DMs, I'll answer it. during those 30-minute times. And then on the weekends, one thing I was doing in the past was I was giving like a weekly feedback form, but it almost felt like a little bit too much at times, where like people were getting a little burnt out of like answering that every single week. So I don't think that's inherently a bad thing. I think for some people that could be really good, but I think as long as I'm consistently touching base with them through day 1, day 2, day 3 workouts, and then addressing any other further things through the DM app, that's kind of primarily how I'm doing it. So I'm talking with them like 1 to 2 times per week, even if it's for like a second. And then phone calls and Zooms as needed. So for me, it's not something that I build in where it's like, we're going to, do a Zoom call in 6 weeks. It's like, hey, let's keep things rolling. If we want to reorient and hop on a call, I'm happy to do that. So I'm kind of using those more as needed.
Okay, makes sense.
If that's helpful. And that's just, again, there's so many different ways people go about remote rehab. This is just what I'm finding kind of works for me.
All right. Awesome. Thank you.
Yeah, you got it. JP, I'm just going to read these 2 questions and then, or I'll read Nicole's question. Do you record your own videos to upload into TrueCoach, or do you find videos that you agree with in terms of the movement? Yeah, it's scouring online. If there's one that's like just a flagrant suspect narrative, then we'll go to a different one. But there's usually enough decent stuff out there. And if it's not perfect, I'll put a caveat in the instructions for the video where it's like, don't like just watch the video on mute. Like don't listen to what they're saying or whatever. But you can usually find what you're looking for. All right, JP.
Sorry, I was typing in a response to that too. Yeah, no, I was curious as well, since I know Steph does a similar thing and she works with mostly ACL athletes, from what I understand. What do you find are some similarities between how you guys do things and some key differences as well? And if that's like a population thing or more just how your brain functions versus how her brain functions.
One thing that she's doing that I think is dope is she's doing like Loom check-ins. So like rather than doing like explicit feedback on every single exercise, like I have 7 clients, she has 30. So it's like the bandwidth, if I was doing what I was doing for that, it would not be time effective. So I really like the idea of like just going through the week and using a Loom video to kind of go through and like give the verbal feedback for how things are looking and how you want to improve it in the following week. So I think that's a really cool strategy that she does that I don't utilize. But I mean, otherwise, like, and a lot of what I'm doing, I learned from Steph, so like the clarity and the setting expectations, the onboarding is so important. Like that's honestly such a low key, but like critical step to, and again, it's like the same thing with rehab. It's like, if you build a good relationship and you set expectations well, things are gonna move in a positive direction, whatever that might look like, you know what I mean? But just from a relationship perspective, you're gonna be able to build one. I think there's, she goes hard, she puts in a lot of thought, and I try to do that and make sure that I'm like taking the time that I need and not just rushing through it and doing things arbitrarily. She has a lot more like fancy systems on the back end to just help with organizing and tracking. And she does have more of the like scheduled check-ins for people, where I don't really have that, but I think that's more of a population thing too. But yeah, off the top of my head, that's it. I think there's a lot of similarities. She's just a bit more advanced than I am.
Makes sense. Thank you.
Yep. Nicole, for those that aren't reading it, Nicole had a good thing in the chat, which was basically like, an end of the week check-in where they can rate their stress, sleep, nutrition on a scale of 1 to 5, just to kind of track how that's going. So that's probably a nice minimum viable, approach to tracking that, to see if it's something that needs to be kind of quote unquote intervened on. All right. Anna asks, how often can you summarize how often you see them for monthly fee charge? How available are you to them to answer your DMs? Do you discuss boundaries on the onset? Don't want to run into the issue of making myself too available and then drowning in feedback. Yeah, so definitely setting the boundaries where I tell them, look, I'm going to be I'm going to be on the app. Like I'll get back to you within 48 hours. I check in Tuesday, Thursdays, Sundays. If it's anything ever super dire, you can definitely shoot me a text, but otherwise that's how we'll be communicating. I charge anywhere from 200 to 300 a month, depending on how many days of programming I'm doing. And it's just a month by month basis. If, you know, and for people, I'm trying to at least get, especially with persisting pain, like a 3-month agreement, and then checking in from there and seeing how much longer we want to work together. Any other questions or thoughts?
I got one, and it kind of goes out to just anybody that's doing kind of remote, because I'm getting interested in it. How do you guys kind of determine what population that you were looking at? Because I know that with remote rehab, especially advertising it or trying to kind of find that patient population, how did you kind of single down the chronic pain for you, Zach, or
Yeah.
ACL for staff and going forward?
Yeah, so I'll start and then definitely people jump in. You know, for me, I couldn't pick just one, you know, and again, this isn't like my primary business. But I enjoy working with a bunch of different people. So it's like I knew for me, I was like, all right, I'll pick 3. So it's like persistent pain, gym goers, which includes like strength athletes, barbell athletes, you know, and older adults with like joint pain, you know, things like that. Like those are the 3 primary people that I enjoy working with, that I feel really competent in working with, that I know I have a lot of experience with. And so for me, that was kind of how I went about it. For Steph, like she was a super ACL nerd, her own experience with it, her whole caseload was basically that. So it made a lot of sense. And also the other thing too is like there's certain populations that remote rehab is perfect for. ACL rehab, I believe, is one of those, because at the end of the day, it's like, give me a person that is going to the gym and working out consistently 3 days a week for a year with appropriate progressions, and that's someone that's going to fucking kill it. Like there's a time and place for in person with that. Through a hybrid model would be ideal, but at the end of the day, like they literally need to be working hard at least 2 to 3 days a week at least. And remote is just such a good way to deliver that, because it allows you to track it and progress it in a more sensitive way, as opposed to them coming in once a week and then having to write stuff for them to do out of it, which is what happens through a traditional model usually. Erin?
Hey, Zach, thanks for the presentation. I really enjoyed it. I am just kind of going off what you were just saying, because I was curious about the same thing when I heard about this presentation coming up is, oh, that's a really great way to work with patients that maybe are not interested or yet, I guess, not interested in all the manual therapy and more motivated to kind of do things on their own. But like you're saying, some patient populations might not necessarily be ideal, but I think it could be a great way to make it more accessible almost. So if someone can only come in person, but they're motivated to get better, whatever reason that is. I've been working with, same as you, a lot of people who are retired or the older adults, and they might not necessarily be self-aware with their movement, or independent, confident enough to do it on their own. Do you have any suggestions for that?
Yeah, so I just took my mom on as a pro bono client, and it's already like, she's like, wait, how do I video myself at the gym? And I'm like, oh God, boomer. But we went over it at home together. That is definitely a barrier, I think, for like the older adult population. It can be like the comfort level they have with moving, the comfort level being in the gym. So like, got to kind of find ways to finesse it and help them understand how to do it. And just, again, starting with basic stuff, but definitely capable of doing it. I think you just need to create a program that's super simple to start and build some momentum. So like my mom's 2-day split has like 3 exercises each on each day. And like, that's where we're starting, just to kind of get familiar with how to use the app and record herself and report feedback. So yeah. I don't know if that helps.
Yeah, that's great. That's kind of my intention, is to get to a point where, patients, they might want to have some of that hands-on time,
Yeah.
or just to be in person. I've been finding that a lot with that population. They like coming in person. And it's not something where, they have a 9-to-5 job anymore where they can't just come in for a session. So yeah, definitely. Thanks.
Yeah. And I would just say, like, that's the other thing with remote rehab is I do feel like a lot of the general population would do really well with remote rehab. I think there's certain cases where obviously it's just not a great option for it, but I would say that is the minority compared to the amount of people that would do really well with remote rehab. I mean, like, one of the things that was driving me nuts working in a traditional clinic was like I work with a lot of power lifters or barbell athletes, and like having them come in for PT felt so like forced at times, where it's like, yo, like you literally like let me just help modify your programming so you can just be in the gym doing what you need to do, like rather than me feeling like I need to church up a PT session where we're working on XYZ different drills to make it feel like it's valuable, when like the reality is I feel hamstrung on how I can help them, because I think that I can and that's what happened. I had a clear conversation with one of my people where I was like, look, are you working with a coach? Yes. Okay, great. Like, let's, because you've been dealing with pain for so long, like, let me take over programming for like, 2 to 3 months. Once you're able to start training intensely without issues, go back to working with your coach. But like, that's the way I feel like I can help people more. Like, runners are another population. I think there's so many populations that like, they don't really need to be going into PT or chiro. Like, they need a good guide that's helping program their activities and their exercises, over time. Like, that's what's really going to help people have a great healthcare experience, in my opinion. All right, I'm just going to read Nicole's question here. Did your patient go to group classes on days she wasn't doing your programming? Did she ease back into classes and decrease the amount of days she did the programming when she felt more comfortable in her own abilities to gauge her pain threshold? So I've literally been working with her for 5 weeks now. So our conversation was basically, so I'm a big fan, like, however anyone wants to work out, hell yeah. Like, I have no issues with Orange Theory. I have no issues with F45. Like, I think all those things are amazing. The one thing that can be tricky sometimes, again, is like the scalability and adherence to that in a more boot camp style thing can be a really slippery slope, because you go in with good intentions, but then you're like, oh shit, Linda's getting after it. Okay, I gotta go. Like, so I think there's a lot more contextual factors that make it difficult to be super consistent with, and it just adds a lot of noise into the equation. So I actually have another person, another mid 30-year-old female, spine pain. She's a cop. She loves Orange Theory, but every time she goes back, she has a flare up. So we're like, look, let's just chill on that. Like, that's kind of like our, Quinn in the building, something he's spoke a lot about, which has been helpful for me, is like defining your end goals. And so for us, it's like, when she can get back to going to Orange Theory and training without like really having to limit herself, like, all right, that's done. We're good. Like, go back to training the way you want to train. But for now, it just adds so much noise that if we can get like a couple of months of just consistent calm together, that's going to help us really move the needle. But again, it's going to be a different conversation for different people, because if it's like the most meaningful thing in the world for them, I don't necessarily want to take that away, so it's going to depend. All right. Any final questions, closing thoughts?
I have a question just in terms of remote management of the exercises. I know being in person, I really like to encourage like self-efficacy, movement optimization, giving people that in-person encouragement and making them feel like it's okay and safe to move. Do you think you're hamstrung in that regard, managing it through online where you're not necessarily watching them do the exercises and giving them?
Yeah, so that's a good question. I mean, in a sense, yes, but like, I'm also still being myself in the comment section, hitting them with the yeses, being super excited, which is naturally the way I am with like seeing them kind of stack these wins and giving them these like, I'm working right now with a young mom, who works a busy job, and We're only doing 2 days a week. She's missed, one of the 2 days twice, but she's done 1 day consistently for the last 4 weeks. And I'm like, let's go. You hit 1 day a week for the last 4 weeks. Like, you should be super proud of yourself. And so I think there's ways you can still kind of get that across, but obviously it's going to be a little bit different than, being able to give someone some of that encouragement on the spot. All right. It is a Roger Federer hat. One of my clients got it for me, and now it's one of my favorite hats. Also a big tennis guy now, apparently. All right, cool. Well, I hope it was helpful. I've been having a lot of fun with it. I really feel like people in this community are so well equipped to crush it doing remote rehab, because it's literally all the skills that we value the most are the skills that make the most incredible remote clinicians. So hell yeah, if you're interested in learning more, I'm definitely around to chat, but there's a bunch of people in our community that are doing this in different ways. I have a 4-hour a week gig too that I'm doing just telehealth for an insurance-based company, just doing evals. So it's cool. And yeah, good times. All right, everyone, have a great rest of your night, and happy holidays to everyone. And yeah, let's get after it in the new year.